Isn't it fun to have him introduce us? I think you all know that I had to fill his shoes. I'm still working hard at that as a county commissioner. In fact, this morning he popped into our management update, which we have on Tuesday mornings. If you want to know what the commission actually does, Tuesday mornings at 9:30, we meet and we talk about all the things that we need to get done in board session in the coming couple of weeks. And Sam sat on the wall, and at first he smiled, and then quickly he has that same scowl on his face. And I watched him for the hour with that scowl thinking, what could it be that he is thinking? And of course, like me, he'll tell you. And he did at the end, and he said, boy, I had a hard time just keeping my mouth shut. I really wanted to weigh in, and I said, on what? And I knew immediately what it was going to be. You'll be surprised to know that Marion County is frustrated with the Oregon Health Authority. It's been an ongoing theme since I've been a county commissioner. And recently, we agreed to go into a memorandum of understanding, essentially, that would give the state access to data. Marion County is data-driven. We think they should have that data so that they know what kind of beds are available across the state for folks who have high acuity need. But one of the things about that contract is it gives them a little more access, a little faster access to the beds that we need in our community for Marion County residents. And that means that other counties have access to those beds a little earlier than they would normally if we were doing old school paper. And while that normally wouldn't be a threat, it is, because we have a serious bed shortage in this state for behavioral health systems, specifically those who have really high acuity needs. And Sam talked about in the past where Kevin Mannix and himself worked on a piece of legislation to do return to county for folks that left the Department of Corrections in Marion County so they could go back to their home county upon the completion of their prison sentence. 2 years ago, we worked with Representative Deal to create more legislation to make sure that people who left the state hospital on an aid and assist order go back to their counties. Turns out Marion County is a great place to be. Everybody wants to be here, especially if you're institutionalized here, and we have the largest number of institutions in the state. So it puts us at a disadvantage. We don't get more money for that. We don't get more staffing for that. We don't get more bed access for that. We just get really, really qualified staff that are really overworked, more than I think any other county in the state. And so I assured Sam, while I agree with him on that frustration, 2027, here we come to the legislative cycle, and we're going to have to pass more legislation to, again, protect Marion County from decisions that are made at the state level out of partnership. So, Sam, I appreciate your service, and I appreciate that there's some like-mindedness between the two of us, considering I'm still filling your shoes. All that to say, Levi, you're inspiring. Thank you for coming today. We had an opportunity to hear Levi at the Safe Agri Banquet hosted by the Salem Chamber of Commerce earlier this year. When I say we, the Board of Commissioners was present for that. And we were impressed by him and his leadership skills and his willingness to kind of share from his heart, but also to bring awareness to the fact that FFA as a program is in danger in Oregon. If you pay attention to the media, you saw during the short legislative session that they were considering defunding that program as an educational leadership system. That makes zero sense to me as a county commissioner. I'll continue to fight for FFA on every given opportunity, and I'm glad that all of you came from across Marion County to represent your respective chapters. There's like 3 tables full of FFA youth in the front here, so if you don't know what it is, I would suggest take some time at the end of this lunch and go shake their hand and welcome them into their leadership, because they are the future of Marion County and agriculture and Oregon in itself. And I really applaud you for the work that you do. I'm just gonna try to keep this as short as possible because I always have a lot to say, but I wanted to piggyback a little bit on what Levi said and on what do you believe. I believe in this community. I believe that we all have a responsibility to find our purpose and then lend that purpose into the space of our community. I think it's my purpose as a county commissioner to understand the needs of Marion County as a whole, everybody that lives here, every community, every public servant, and try to figure out how to collaborate those systems together to produce the best outcomes for everyone that lives here. We have a lot of challenges ahead of us, and we do a pretty good job as a commission sharing those challenges as much as we possibly can in the media, because it shouldn't be a secret. Oregonians shouldn't be left in the dark to know what barriers we're facing. But I'll tell you, Marion County is really unique in how we navigate those barriers. We work really hard at the local level to try to overcome them and find sustainability and ROI on our investments. And we're making some great gains. On the legislative front, since Representative Salinas has been in Congress, she's been a very valuable partner to Marion County, very present and very willing to listen. When she first took office, I sat down with her and talked about what I believed the priorities should be for her to focus federally on legislation around behavioral health. One of the biggest challenges that we face is a lack of beds for secure residential treatment facilities. And we lack those beds for a variety of reasons, but also because Medicaid has a cap on them. And she did her research and she worked extensively with our team and another Washington County team and finally drafted legislation. It's current. I just saw it in February when I was back in DC visiting. And I can't tell you how proud I am of the fact that Oregon is leading the way to stabilize individuals in their health, their mental health, and finding a space for them in their communities. And I hope that Congress sees that as worthy legislation and passes it sooner than later with all the chaos, so we can start to increase bed capacity for individuals to have access to, but also to save dollars. Because we have to build multiple buildings, ask Bryce Peterson. Is he here? I saw his name on the list. Bryce, are you here? Yeah. He has overcome some serious hurdles in the state. Jory Health has opened recently. Thank you for your battle to get that open and to serve some folks in our community. I read a report today that says you're doing great work, and of course you're facing hurdles, but you're still present working through that. And I hope that the next facility you build allows you 32 beds instead of just 16. At the local level, we battled through the 2025 legislative session, probably one of the hardest sessions I've experienced as an elected official and Oregonian. Money is a big issue. We heard that a lot. Transportation, behavioral health, education. For me, I've been focusing on a topic around behavioral health the entire time I've been a commissioner, and it's really around civil commitment. Everybody that knows me, has heard my story, knows that civil commitment is something that I believe is necessary for folks who are really struggling in their mental illness. And they should have a safe place to go to stabilize them until they can return to their community if that's possible for community placement. While we succeeded to lower the bar for civil commitment, to have courts and district attorneys work together to provide access to civil commitment, we have no way to transport them. I don't know if you know this, but we don't actually have white vans of guys driving around with white coats to pick people up and transport them at all, anywhere in Oregon. We never have. What we have relied on always is our law enforcement partners to be able to enter into a situation thoughtfully with a court order to be able to transport. Well, because of 3 use of force cases, recently one out of California 2 years ago, law enforcement can't be our partner in behavioral health in that transportation, which means we cannot transport people when they need transport. So we have another barrier that we have to get through. It's my responsibility to work across the aisle and to work with all systems and all beliefs to figure out how to serve the person in front of me, in front of my team, to the best of our ability. We worked really hard in Marion County with partners like Disability Rights Oregon, the trial lawyers, a variety of adversarial partners typically when it comes to this kind of legislation, and we had the votes in this short session. We worked really hard, and then the chair of the committee on the final day, just because he can, decided to kill the bill. We also had the votes in the Senate. We could have passed it, we could have written new law, and we could have provided access to a system that many people in our community need. And here we are again. I promise you I will be back in 2027 Oregon legislature with that legislation because we are going to get this done. But we need more voices at the table. So I invite anybody in this room that thinks civil commitment's a bad idea or transportation by law enforcement's a bad idea to reach out to have a conversation with me. I'd like to understand your perspective, and I'd like to change your perspective and ask you to be an ally with me in 2027 to get this done. Representative Tom Anderson, by the way, is the one that drafted that legislation. On the front of being accountable to taxpayer dollars and ROI, something I learned from Dick Bethell over the years of what I would say is being a reluctant mentee of his, we invested in 2020, maybe 2019, in an electronic records management system for the health department. And while it was torture getting it online, mostly for Ryan, wherever you are, it's produced some fruitful results. In fact, just like a week ago, we went through a full report of the health department priority programs for the commission and received data on several of them. And I just want to break down a couple of the things that are really hot topics for Marion County, but really for the community of Salem. Our addiction treatment services team had an 8% decrease in clientele, but still had access to 94,000 encounters. Our adult behavioral health team had no change and had 56,000 encounters. This is just for 2025. Our behavioral health crisis center, some of you may know that we doubled, maybe tripled the size of that recently and relocated over to 1234 Commercial Street. They had a significant increase with 30,000 interactions. And we created a new program last year that's overseen by Naomi Hudkins, focusing on housing in the health department, and had a 36% increase in interactions in our community, serving over 3,700 individuals, focusing on housing as a stabilization factor in life. For me, data systems provide timely information so that way when we're looking at our community and the needs, we can pivot. It's not on emotion, it's based on data. How many people are coming in and what is the waiting list? What is the definition of that waiting list? What is the acuity of need? And how do we pivot such a huge government to make sure that we're serving our community? We now have a system in hand that can help us do that. Being data informed is really important to me, and this report will be available to the public at some point, probably on their website, I imagine. We face some additional challenges statewide with funding. The Behavioral Health Resource Network, which is funded by Measure 110 dollars, received a substantial reduction in funding, which means anybody that received a contract for addiction treatment care received a reduction in funding. In our community, I know of 5 positions from community-based organizations be laid off. We were able to stabilize because our system is a little larger as the county, but we're still impacted by that. It's not a sustainable program of funding to focus on addiction treatment services, and we need to have partners at the state level to work with us at the county level to pivot in our communities and provide really unique services. And we still don't have any prioritization of youth in Oregon. Statewide, they keep talking about it. We're gonna keep studying it. But I can tell you, front hand, we have issues. Our juvenile department is active, very active. Our chief district attorney is sitting over there shaking his head, does a lot of juvenile cases. And we have contracts now with Washington County and Clackamas County Juvenile to take their youth into our facility. That speaks to 2 things. 1, there's a need, and 2, Marion County does juvenile services really well because 2 of the largest counties in the state want to be our partner and house their youth with us. And they have a fast rate of return into their community, which speaks to our staff and the services that we provide those youth. But more importantly, my point is that we don't have a statewide lens and partner focusing on the most vulnerable age range in our community. Prevention's really important, but if we can get to youth early, we can prevent long-term harm in their life and in our community. And I would encourage all of you to be thinking about what that looks like to you, and as you're thinking about how you can make an impact, use your voice in that space. 2 final things. Marion County now has 5 outreach teams. When I became a commissioner, we had 1, the Law Enforcement Assisted Diversion Program. Now we have CARES, which stands for Crisis Assistance Recovery Engagement Support Team. It's a team of a deputy and a lead navigator that go out into our camps and build relationships with our individuals experiencing unsheltered and bring them into care. It's not even been online a full year. I think next month a full year, April, looking at the sheriff for confirmation. And they have had huge success rates of bringing folks into housing and stabilization through that relationship. It does take time, but it takes humanity. And this Board of Commissioners in partnership with our sheriff is making that happen, and I'm really proud of that work. We now have back one of our MCRT teams, which is an officer with a QMHP or AP. And we're now funding that out of our own resources because the state stopped funding it 2 years ago. We saw the response, we saw the outcome, and we decided that we needed to figure it out locally, and that team is doing really good work. The point of that team is to prevent taking people to jail. It's to prevent law enforcement from responding into a situation that doesn't require jail, but otherwise would, because we didn't have a qualified mental health professional present to navigate that system. We have our community response team, which is our health-related response team, the qualified mental health professionals that are going out of the community on 988 calls. And most recently, and I know you heard about it, this is the State of the City. I didn't get to come, Mayor Hoy, but I heard you did an excellent job. The REACH team. And I don't know how much data you provided, but I brought some from our team they gave it to us last week as of March 11th. That team is a partnership with Salem Fire, an EMT and a paramedic and a qualified mental health associate, ride around in a Suburban, focused as a priority in downtown Salem to prevent fire engines and law enforcement from having to go through calls that we can mitigate at the local level, the most local level. Just in a few short, they're not even online full 3 months at this point of data. They've had 92 contacts. They had, of that 92, 7 people decided to not participate, 55 were transported, and 27 were stabilized in place. The purpose of this team is to reduce the cost of resource response, but also to reduce the burden on the emergency departments, which we know have really long wait times across the state, but for sure here in Salem, and to prevent people from recidivating in that system. Being able to connect them to resources right on the spot, which this does, and it very successfully, of those 92 individuals, they connected 89 of them directly into services. Whether it was 988, Center 50 Plus, Arches, the Behavioral Health Crisis Center, Center for Hope and Safety, HOPE, which is downtown Salem, Northwest Senior and Disability Services, Safe Sleep, and Salem Health. The Board of Commissioners recently reviewed this data, had a conversation with our health team, and felt that the pilot is going so well, they want to continue it for an additional period of time in partnership with Salem if that's what their council decides. Mayor Hoy, I know that public safety and livability is your priority as mayor, and I want to say thank you for being committed to that and working with the commission on bringing pilots forward to find the sense in it and finding stabilization and really getting true outcomes. This is true outcome, and I have the data to prove it. Well done. And then I hope one of you talks about economic development and some of our investments. Perfect. I won't go into any of those topics, but I can tell you I'm really proud of the investments we've made with our economic development dollars across the county in the last year. But one of the areas that really inspires me in our behavioral health system is where we can bring families into housing, wrap them around in services, and maintain stability for their whole family. You've heard us talk about Her Place, you've heard us talk about His Place, and last year we talked about opening Our Place. It's now been open, 8 months or so, with folks in it. Our Place is a partnership with Catholic Community Services. It's a 12-apartment complex over in the Highland community of Salem, and half of those units are for Marion County's behavioral health team. And we place families who are navigating an addiction, one or both of the parents, but doesn't have to be both, into a unit with their children in partnership with DHS and the courts to make sure safety, of course, is utmost priority. But we just had a baby born into a family unit just a couple of weeks ago for the first time to Our Place. That baby would not be with its parents right now if it wasn't for the Marion County Addiction Treatment Team and Terry's desire to have an Our Place. One of the most important things to me, probably the most important thing to me as a community member and a mom, is kids in our community. Keeping kids with their families as long as it's safe is the priority. However I can navigate that, whatever creative program we can bring online that's sustainable and makes sense, I'm gonna do. And what we do with behavioral health is really important, and what we do with the community with Soaring Heights and 4D Recovery is really important. Eric is here. I didn't see Victoria, but so is Corey, and I just want to say thank you for stabilizing the lives of 35 kids last year in home with their parents. We have a lot of trauma in our community, and this week I was impacted by some trauma. We have a lot of work to do still together. And in the last 6 months of my life, I've lost a cousin to overdose and a community member to suicide. Everything that I talked about is data-driven, but we're missing things. I can't do it alone. I need all of your help to continue to be the best public servant possible. Don't just read the headlines. Lean in to what that looks like and where it is in your community and take responsibility. We all are responsible for our communities. And I invite you into this space with me to make sure that we can make a difference whether it's your neighborhood or a city next door, to show up and lean on and lean out for people. Thanks for being here today and for being a part of Marion County.